Are they with you? And before we go to the business, just tell your neighbor, we are here to learn. Tell them that. So why did I say that? We have got beautiful pictures. We have got Wi-Fi. It's easy for us to drift away in the program, isn't it? So we have time for that during tea breaks. We have time for that during lunch.
And all invited guests and distinguished participants. I want to take this opportunity to welcome you to the second edition of the Zimbabwe Adolescent Health and Wellbeing Symposium. Yes, you can clap. Thank you. Distinguished guests, esteemed colleagues, and most importantly, the young people of Zimbabwe. Welcome to the second edition of the Zimbabwe Adolescent Health and Wellbeing Symposium. It is a true honor for me as a young leader and as the director of MyAgeZimbabwe to join you here today. 1 year ago, we gathered at Monomtapa Hotel. What we had as young people, starting from the young people that we work with at MyAgeZimbabwe, was just a dream. Our dream for the past 7 years has been to make sure that young people take a seat where it matters, and that young people participate meaningfully in decision making. Ladies and gentlemen, let's stand up and help me welcome the Director of Reproductive Health Unit in the Ministry of Health and Child Care, here representing the Minister of Health and Child Care, Dr. Lucia Gondongwe. Let's give her a round of applause. You can do better. You can do better. Thank you, thank you, thank you.
Thank you for the introduction onward. A refreshing morning to you all. Allow me to give this speech on behalf of the Honorable Minister of Health, Dr. Douglas Tendai Mombeshora. My salutations goes to the Secretary for Health and Child Care, Dr. AJV Maunganidze, Secretary, Youth Empowerment Development and Vocational Training, Mrs. S. Mhlanga, representatives of the UN agencies, that is UNESCO, UNFPA, UNICEF, WHO, and UNAIDS, senior government officials here present, representatives of the civil society organizations, adolescents and young people, members of the press, ladies and gentlemen, and all invited guests, distinguished participants. Distinguished guests, esteemed colleagues, and most importantly, the young people of Zimbabwe, welcome to the second Zimbabwe Adolescent Health and Wellbeing Symposium. It is a true honor for me to join you all here today. Compared to last year, this time we have a lot of young people. Last year, it seemed like it was a meeting of us, the adults. So I'm happy to see so many young people in one space with one goal. So we want to acknowledge the leadership of MyAgeZimbabwe Trust, a vibrant youth-led organization that approached my ministry to partner and create this platform. They have truly shown that young people can take a lead in creating spaces for conversations and commitment on their health and well-being. We also thank all the partners that take heed to this call. My ministry continues to acknowledge the significant challenges our young people face, from mental health struggles to barriers to education and economic opportunities. But we also celebrated the progress of our government had made in developing comprehensive policies and programs to address these issues, and need to review some of these policies in a bid to make sure that every young person in Zimbabwe has a chance to live a healthy and fulfilling life. Zimbabwe is still grappling with various challenges affecting our young adolescents and young people. Literature available shows that adolescents in Zimbabwe, they face various challenges, including high rates of unplanned pregnancies, early marriages, and childbearing, high maternal mortality, high HIV and STI prevalence, and gender-based violence, amongst others. Specifically, according to the 2019 mix, they noted the following. Adolescent boys have a higher attendance rate in rural areas than girls, and attendance for girls is slightly higher than that for boys in urban areas.
And I want you to be lifting those hands as you hold them. And I want us to repeat this commitment as an affirmation for all of us. Say together, say together, across sectors, we are prioritizing the health and well-being of young Zimbabweans in all their diversity to help ensure that the country's young people are able to thrive and contribute to a more prosperous future. Amandla! Amandla! Thank you.
Ambassador, I know this, that the last round of hands was yours, but we share the credit. Man. I was standing here when the claps came. Okay, wonderful. You are not going to be settled for long because I want you back here. But I just want to give the young people the 30 seconds to breathe.
Comes to which rooms are we going to go into? So we have a session titled Main Plenary. Main Plenary is resourcing, movement building, and capacity strengthening of youth-led organizations to reach out to young people on health and well-being. They will be coming back into this session room, in this conference room that we're in right now. And then track A, ending unintended pregnancies and unsafe abortions among adolescent girls. That is track A. You're going to be going into the conference room that is on my right. So through those canvas, khaki, in there. That's that's track A. And then track B, you're going to go into my left side, canvas, khaki, that side. That is mental health, nutrition, and psychosocial well-being of young people. And then track D, access to inclusive and affirming services. There is a gazebo that is at the back of this conference area. You can check outside and we'll direct you there. There's a gazebo that's there. That is where this track is going to be held. So for everyone who is not on a panel, you are free to get into any of the session rooms. Whichever one you need more knowledge on, whichever one you have more information on and you want to share. So you're free to get into any of the sessions, either this plenary, the one on the right, the one on the left, or the gazebo. All right? Are we together? All right, so see you after tea, people. Enjoy.
So I can stand. I can sit on the stool. Zvaramboti ndimire kwaigara. All right, so let's get straight into it. Gaga, so that we have enough time to talk about this. And I'll throw in my first question to all of you. So anenga dangotanga kupinda ne question. It's open. What are the most pressing health and well-being issues that are facing young people today in Zimbabwe? Maybe we can start with you. And you can just introduce yourself so that you jog our memory. My marriage also, remember.
Right. Thank you very much. Good afternoon. My name is Unati Nyoni, former child president. I now sit in the 32nd session of the Junior Parliament as a junior senator. This is a, thank you. This is an effort from the Zimbabwe Youth Council to continue nurturing and capacity building and investing in resources that they've nurtured from Junior Parliament upwards. One issue I'd like to focus on, because I know it won't be very prevalent, it has actually come to my attention that Zimbabwe unofficially has the highest mental health burden in sub-Saharan Africa, and also it is possible that that burden could be in the whole of Africa. So it could be the highest ranking in terms of the mental health burden. And this is an issue that is pressing, but it is an issue that is not mainstreamed within our health advocacy. You see that the proof that it is not mainstreamed is how it's not packaged within the Public Health Act.
Please do not put my head on the block. I'm not representing the government to say, but I'm simply going through the procedures. So there is this misconception that we have in our country, and it's deliberate, that we think that laws are made in Parliament. Laws are only processed in Parliament, but laws, they are made with the executive, the president, the line ministry, and the attorney general's office. Are we getting one another? The Parliament is there as a blast furnace to say, of all the things that you have discussed there, how much of that is in tandem with the law? Are people aware of it? And how best can we do it? Let me give you a very brief example. It's very expensive to facilitate a public policy process. You need to do public hearings in all 10 provinces, in all 1,000 districts, in all local languages, feeding people and making sure for their safety. So I will not go into the private member bill. I'll just speak up briefly today about the procedure. So after this, I'll then share with you the document. But for now, to share it with you in the group doesn't mean anything. We understand one another. Then one last thing is that public policies are not the only documents that are written down. I'll give you an example. We all come from rural areas, right? Ekaya. I don't know how best to put it in the beautiful language of Tebele. But is it written anyway that if you don't go to the fields on Friday or on Sunday? Is it written anyway? But don't we practice it religiously? We do, right? That's a public policy on its own. Right there, that's a public what? But it's enforcing us on how we behave and one-on-one. And when you break it, we go to the chief, right? You've done A, B, C, D. So when you talk about public policy, let's understand that it's documented and undocumented. That's number one. Number two, we're speaking about youth-friendly health policies, aren't it? And then we said, how many young people understand youth-friendly policies? Majority of us would say it's the public health policy from the Ministry of Health and Childcare, right? Mm-hmm. But the budget is one of them. The drug and substance abuse plan is one of them. The NDS one, the budget, the youth bill that we're currently speaking about, it's also part of the legal architecture. So now you cannot know all of this at once. That's why we say as young people, let us try by all means to then focus on specific areas so that when we go there, when I know you know a lot about public health, you know a lot about budget, you know a lot about the youth bill, we're able to concretize our arguments. Is that so? Yeah. This was just the foundation to lay down. And why is this important? There's a high-level meeting that is happening on the 4th and the 5th about the youth bill, all right? And it will be important for us to have at least 2 or 3 things that we submit there. So I'm now going into the legislative authority. So I'll share with you, but section 116, and the lawyer is with me here. of the legislative process gives power to the president and the parliament to make laws. The legislative authority is derived from people and is vested in and exercised by the legislature that is power passed through new laws. I don't want to read it because it will go in the lecture mode. But we have what we call the executive, our minister, our president. These are the people that do that. Why? Because the highest lawmaking authority in the country at the end of the day is the cabinet. When we talk about policy at a deeper level, policy in itself is a political process. Do we know that? True. Let's use a family model. That don't have a football is not their problem. You don't have a bicycle, it's not their what?
The problem.
So if you want to now have a bicycle, you need to talk to mama very well. Then mama will talk to daddy very well. The problem in Zimbabwe, especially young people, is that we are very confrontational. There are two ways of advocacy. There's the confrontation and it happens in the streets. Then there's the boardroom process like this symposium, where we need to then look at each detail. So understand where you fit better. All right. After that, section 113C operates through various ministries. Okay, I'll share the document. The first thing is that the line ministry will take a document to the government to say, we have realized this problem. It doesn't mean that we need to have a public policy when there's a problem. A government can be proactive to say, you know what, proactive, there might be a problem of A, B, C, D, let's have a futuristic policy. The government can come to breach the vacuum of an existing what? Policy. Or the government would come and repeal a policy. I know a lot of people here are very vocal about the death penalty, right? And a lot of people are saying, can we bring it back because of sexual reproductive health? And we've got court cases that we can talk, the Mildred Mapangure, the Kamawanda, all those cases. So this is the space where we can have the policy. After the line ministry have seen a problem, they develop what we call principles of the abuse. Principles of the abuse are a skeleton to say, there is a problem, we need to solve it. Then they simply list the problem. They don't go to itemize and to then operationalize the problem. When they do that, they take it to the Attorney General's office. Now, this is where we say Zimbabwe is a member state of UNESCO, a member state of AU, we need to ratify A, B, C, D. That's the space of the Attorney General. When the Attorney General has gone through that, and again, this is a safe space, they also look at the political value of what we're tabling, they'll bring it back to the cabinet to say, we agree, let there be stakeholder consultations. Now, my fellow brother, is it Unati? Yes. So Unati was in your position as a child president in 2013. I know for a fact that we sit in these meetings. Most of the times, because we lack capacitation, we don't understand what we are doing there as the junior parliament. No shade to him or to myself, but I didn't understand anything when I was a child president. All I cared was to say, so are there horses to come with my car and all those things? And Econet was giving small phones by then. I wanted my phone as the president. So in those high-level meetings now, when we talk about the Attorney General's office, we need to have strategic young people unpacking these things. Colleagues, it doesn't matter you're a lawyer. I'm not a lawyer myself. But problems, they affect both myself and the lawyer. So we have the problem when we go to parliament, we want to actualize and to speak big grammar. Just say it as it is in that high-level platform. Young people don't have A, B, C. That's why the parliament is there to formalize and put things in a framework. Don't try to be a member of parliament more than the member of parliament themselves. Are we getting one another?
Yes.
That's the first thing. We go to the Attorney General, the stakeholders are done, line ministers are listening, because you cannot talk about having a youth bill, then you don't talk about how do we finance the youth bill. We don't talk about how do we offer protection to the young people even when they whistleblow. So line ministers, they need to agree, they need to talk. At that high-level meeting, UNAT will be there. Gloria, if Gloria was from Zimbabwe, FP30, people that are working with UN agencies, they are there as young people. And more recently, I know NAC, they are now being part of those processes. Even when we do our training as ZYC, we talk a lot about these things in terms of sexual reproductive health, safeguarding and all that in our own languages. After that, then the Attorney General's office and the line ministry, they bring the policy to Parliament for the Parliamentary Portfolio Committee on Legal and Legislative Affairs to see if the policy that is being proposed does not then affect the people. Now, this is where the Parliament starts to interact with the law. But already have you seen that there are 5 stages that happened within the background? You understand? So the parliament will first do what we call the Portfolio Committee on Legislative and Legal Affairs. They'll look at that, then they give their comments, they invite the minister. But first there's going to be what we call the first reading. The first reading is where the long title of the policy is said. Do you know policy documents, they are very long? They are very long when you read the long title. So it's a reading with a notice. They read that, that's what we see on Tuesday when ministers come, they speak, then they go back. Then there's a second reading where the ministers being brought, involved stakeholders, they must come. Then there's a third reading where the minister will defend. But our Zimbabwean parliament is broken into 2. I know I'm rushing and it sounds like Greek. I'll give you the document. We have the National Assembly, then we've got the what? Senate. Unati is saying he's in the Senate, right? So the National Assembly, unfortunately in parliament, they are called the small boys. The Senate are the big boys. You see, you lower chamber, upper chamber, you need to be 40 to be in the Senate. So the Senate, the National Assembly will debate and do what they do. If they agree, they will send it to the Senate. The Senate has to do the same process. Do you still remember there was an interesting case that was being led by Wilco? Is it Wilco's? Yes. Issues of the Marriage Act. I know for a fact there was a time when it caused noise and the minister was like, relax for a bit, we'll make progress, but you are rushing too much to parliament. So what I'm simply trying to say is that let us not alienate the line ministries when we do this. It's very important. Are we understanding one another? Yes. So who do you see when you go to the line ministry? They've got what they call the youth focal desks. Whether they are functional or not is a debate for another day. But at least you have their email, you have their number. Do you understand one another? By the show of hands, how many of us here knows the number of their councillor or their member of parliament? Whether they come from Dynamos or Dimbare or Highlanders, you know what I'm saying? Or whether they are green or yellow, whether they are responsive or not, how many of us know those people? Let's do a very simple quantitative survey. You can see that more than half of the room, they don't know these people. So it's important that we know them, whether results are coming or not. Then after that, when the National Assembly has agreed in the Senate, they then send it for public hearings. That's where most of us will come in. I've been a rapporteur of public hearings as a young person. And you hear young people, they say, we don't like the law. The law is very discriminatory. Thank you. They sit down. They do not itemize what is discriminatory. They do not then go a point further to say we need this. They then go a step further to say finance it in this way. They leave it vague. So, number one, our submission lacks substance. It lacks political appeal. It lacks economic appeal. It's just a what? A submission. And let me tell you, those people, they like that kind of setup where we give them empty engagement because it makes their work easy. So, it's very much important that Saturday did this exercise when there was the Children Amendment Bill. They had a caucus with their young people to say, this is what you should look out for. This is how you should table yourself. Now, we now live in a globalized world. It's very important. I've seen people that attack public professionals, those sitting in the office. Delight is Dumburakazarawawa. I'm a minister. I know, I see you. Then tomorrow at the face of a campaign, do you think we are going to interact? No. So I'm not saying be an advocate, be an activist. I'm not telling you what to do. But I'm trying to say within a procedural and a very technical ecosystem, how can you make progress? How can you interact with these people? And it doesn't end there. Sometimes you are not able to attend a public hearing. Write to parliament. Write to council. We understand one another. Then this fits within the broader framework of advocacy and its place in change process to those that will do public policy and governance in their tertiary academics. So this is very important that number one, the line ministry, let us respect them. Number two, the parliament, let us engage. Number three, let us write. Then number four, let us refrain from attacking people. Don't any colleagues. But when you say what does it solve your situation? It only degenerates your dignity as a person. It makes it very difficult for you to interact. So I will be sharing the document in the symposium group. If there are any questions that may arise, I'm more than happy to then say, how then can we discuss this, even maybe in the evening or whenever I got space. but it's very important. And one last thing, Madam Chair, not to waste your time. Let us not be process people alone. When I say process people, you've got people that are very good at planning programs. But to say, okay, can you write a policy brief? Can you write a white paper document? We can. Even when you post, you miss the objectives of what we are doing here. You're just supposed to say, at the symposium with your filtered, beautiful picture. Then the picture of your food, picture of your shoe. Advocacy happens in a lot of spaces, in many ways, isn't it?
Yes.
So thank you so much for this. I know it's very big, it's very broad, and I didn't want to bore you with sections to mention them, but I hope I didn't confuse you more than when you walked in here. Did I confuse you more?
No.
Did I? Someone is saying yes, I'll take that as a question, just one question. What did I say that was so wrong?
Okay, so we all heard about policymaking. As young people, number one, I can't even define what is a policy. Number two, we don't read the constitution. We don't even know which one is which. So you're explaining how it works and all the procedures we should follow. But the basically things we don't know. So we have, okay, it's like we're 8 days before we apply. So basically, we are confused. What are we talking about? What is the policy? What's the constitution? What is what?
All right. Thank you so much. So I hope there's someone from my age. This is more like a mid-process evaluation, isn't it?
Yes, yes,
To
yes.
say we need to understand more about policy, but I'm happy that there's this confusion or there's this appetite that I've provoked in you, so that when you speak about this issue, you can research a little bit more and to see how best can I do it. One last thing that we need to do, and thank you for bringing it up. She's the young person who's got access to space. But again, she also needs capacity to understand these issues. So what I'm simply trying to say is that, number one, let us train one another properly. Number two, let us give feedback. I hope in our social media spaces, I'm going to see blogs, I'm going to see engagements, I'm going to see Twitter spaces and all that. But now, let's speak more about policies, maybe at breakfast tomorrow, wherever that you want, so that we assist one another. Even the conversation can still go on within the what? Within the group. Trust me, you're not the only person. Even the members of parliament themselves, where if you really corner them to say, MP, they will tell you, young man, I'm a people's person. That's why I'm here. People love me.
All right, thank you so much. I think we can dive deep into the question. Please give them a round of applause. Thank you, thank you. Any burning questions for our panel? Yes, over Mike Irikurenewoto. Yes, you. Okay, so before you ask your question, do you want to then respond, or we can capture all the questions? Munachinota question ya direct kokwari, then we just respond. Okay, cool. So your question?
All right. My name is Michael. That is why I wanted the mic. Anyways, my question is on frameworks. Like, we realize that in Zimbabwe we have what we call brain drain, right? Where much of our health workers are moving outside Zimbabwe to go outside Zimbabwe, thereby leaving us with maybe a shortage of health workers here in Zimbabwe. And then as young people, we realize that us as young people, we don't like waiting for a service. We are very impatient, right? So when you go to a health center there, you have an STI, and then you realize that Pan Boaswika, there is an auntie there, she's very swamped, right? There's a long line there of people who want to be tested, right? And then I am a young person, I don't like waiting, I'll just go back home. Whatever happens there, happens. So I wanted to know if are there any frameworks that have been designed by the government to address this challenge of brain drain in healthy sector. Yeah.
Okay, thank you for your question. I don't know who's going to take it, but so they're going to answer your question for you. Next person with the burning question. It can even be a contribution. We're not limiting it to questions.
Okay, thank you very much. Mine is like both a question and a contribution. The first one goes to the policy awareness. The fact that young people in here were being capacitated or being given information on policies gives me worries on those who are in my community. And the question would be, what is the role of the government in terms of policy awareness, and what's the position that we have? Should you not actually advocate for policy awareness and budget allocation so that young people down there can be educated? It may be throughout our education curriculums. How best can we include policy awareness? Because there's no way that a young person can start advocating or holding a certain duty, bear accountable for something that that they do not even know. Then the other thing is, in our policies, I see there's a gap in terms of definitions. Most of our policies are saying young people, are saying youth. Yet it's difficult for us to then hold them accountable for adolescent issues. And we realize that in programming, if they mobilize people who are 18 and above, they'll just have a general conclusion that we have engaged the youth, but disregarding the fact that they're adolescents. So recently I observed...
Yeah.